Today I will discuss about Whipple disease. Whipple disease is a rare bacterial infection caused by the bacterium Tropharima whippili. It primarily affects the small intestine, interfering with the body's ability to absorb nutrients, but it can also impact other organs, including heart, brain, joint, and eyes. The disease has an estimated incidence of approximately 1 to 3 cases per million people per year. It predominantly affects middle-aged white men, typically between 40 and 60 years of age. The male to female ratio is approximately 8:1 to 10:1, indicating a significant male predominance. Okay, we'll go to the Whipple disease symptom. The symptoms of Whipple disease can vary widely and may develop gradually over time. Common symptoms include gastrointestinal symptom, chronic diarrhea. There is mostly steatorrhea. A lot of fat will go and the stool will float in the water. Abdominal pain and cramping, weight loss, steatorrhea, fatty stools, oculomasticatory myoarrhythmia. Eyeball move inward. There will be movement of the jaw along with the eyeball movement. That is very pathognomic to that of Whipple disease. So this is a collection from Google. Let's start. What is the mnemonic Whipple? Weight loss, hyperpigmentation, infection by Tropharima whippili, pus. There is periodic acid shift, granule in the macrophages. This will be foamy macrophages in the lamina propria of the villi. Polyarthritis, and that is usually migratory polyarthritis. Lymphadenopathy, enteric involvement, intestine will be involved, there will be malabsorption, there will be steatorrhea, there will be anemia, there will be weight loss, okay, and steatorrhea. We are seeing here pus positive macrophages, large lipid vacuole in the intestinal biopsy. Let's go to the systemic and other symptoms. Joint pain and arthritis, often migratory and non-deforming, fever, fatigue, anemia. Lymphadenopathy, swollen lymph node, and the lymph node inside the abdomen may cause also the malabsorption and diarrhea. Neurological symptom, if the central nervous system is involved, such as confusion, memory loss, ataxia. Okay, so the cerebellum both may be affected, will get ataxia, and alternating movement cannot be shown by the patient. Oculomasticatory myoarrhythmia, just we discussed, eyeball moves both inward, outward, also along with the jaw movement, very pathognomic for the Whipple disease. The morphologic hallmark of Whipple disease is a dense accumulation of distended foamy macrophages in the small intestinal lamina propria. Here is the lamina propria of a villi. Okay, we got that. The macrophages contain periodic acid shift positive diastase resistant granule that represent partially digested bacteria within the lysosome of the macrophages. That is in the B, we'll get this here, and in the lamina propria, looking at macrophages here. Okay, Intact rod-shaped bacilli can also be identified by electron microscopy here. We got that. And it may be confused with that of Mycobacterium tuberculosis because that is also a bacilli, but that may be pus positive but not the acid fast, like the TB microbacterium organism is acid fast, which is not the bacteria of Whipple disease. The bacterial Whipple disease is a type of bacteria in the group Actinomycetes. So it is also rod, but it is different from Mycobacterium tuberculosis. It is not acid fast. Villus expansion caused by dense macrophage infiltration imparts a shaggy gross appearance of the mucosal surface. Lymphatic dilation and mucosal lipid deposition account for endoscopically visible white and yellow mucosal plaque. In Whipple disease, bacterial-laden macrophage can accumulate within the mesenteric lymph node, synovial membrane, cardiac valve, brain, and other sites. The disease is caused by bacterium Trophirima whippili. While the bacterium is relatively common in the environment, Whipple disease itself is extremely rare. It is believed that genetic factor and immune system dysfunction may predispose certain individuals to develop the infection. It appears more likely to affect men aged 40 to 60, white people in the North America and Europe, farmers and other people who work outdoors and have frequent contact with sewage and wastewater. Pathogenesis, we continue a diagnosis. The lining of the small intestine has fine hair-like, we can say also finger-like projection that help our body to absorb nutrient. Whipple disease damages the villi, impairing nutrient absorption. Nutritional deficiency are common in people with Whipple disease, can lead to fatigue, weakness, weight loss, anemia, and joint pain. Diagnosis: typically by biopsy of small intestine, detect periodic acid shift positive macrophages containing bacteria. Polymerase chain reaction or PCR confirms the presence of Tropharima whippili DNA. Immunohistochemistry or electron microscopy can also be used to identify the bacteria. Treatment typically involves long-term antibiotic therapy, often starting with intravenous antibiotic like ceftriaxone or penicillin, followed by oral antibiotics such as trimethoprim, sulfamethoxazole for at least 1 year. Early and adequate treatment is crucial to prevent fatal complications, especially if the central nervous system is involved. Prognosis: with appropriate treatment, prognosis is generally good, but without treatment, Whipple disease is usually fatal. Relapses can occur, especially if the brain is affected. And that's all about Whipple disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.